every month, but the blood is trapped inside your body. That's what women with this condition we are going to talk about today go through every single month. Welcome to Talk Health with Nurse P, where we give you health tips in simple and practical ways. Let's talk about this condition called endometriosis. Endometriosis, a condition that many women in Nigeria or the world are suffering in silence. Now, what is endometriosis? Endometriosis is when the tissue similar to the linings of your womb, the tissues of your womb are growing outside the womb. Right? Take that again. Endometriosis happens when tissues similar to the lining of your uterus, that's your womb, starts to grow outside the uterus. It can grow on the ovaries, it can grow on the fallopian tube or any other organ, right? Now, every month, these tissues, what it will do is that just like if it was in the uterus, it bleeds. You get me? Now, imagine the tissues of your uterus is growing in your ovaries. Now, on a period when you're having your menstrual period, right? The time of the month when you're having your menstrual period, that tissue in your ovaries will bleed as well. Now, this bleeding gets trapped in the ovaries because it does not have that facility for the blood to flow as it would have if it was in the uterus, right? Yes. Now, but here is where the problem lies. That blood that is bleeding, maybe in your ovaries, maybe in your fallopian tube, do not have anywhere to go to, right? Now, it will now result in an inflammation, internal bleeding, or scar tissues that will not allow or make this part of the body, these organs, to begin to stick together, right? Yes. Now, this whole endometriosis can now lead you, the woman, to severe menstrual cramp. Yes, severe menstrual cramp. A cramp that makes you to miss school, miss work, makes you to lie in bed all curled up. You cannot do anything when you're on your period. This could be a sign of endometriosis. Number 2 is that it can result in heavy bleeding, heavy menstrual bleeding, right? Heavy menstrual bleeding. Number 3, it can result in chronic pelvic pain, right? Chronic pelvic pain. Another thing is that it can lead to difficulty in getting pregnant. A woman with endometriosis may find it hard to conceive. And sadly, most women are told that this pain that they experience is just a normal pain. Every woman is experiencing it. My sister, no, it is not though. It is not. When your body is giving you these signs, just know that something is wrong somewhere. Now, here are important details to note. Here are important details to note when talking about endometriosis. Number 1, endometriosis can affect fertility. In fact, it is known as the leading cause of infertility in women. But many women can still get pregnant with proper care. With proper care, you can get pregnant. Take note. It is the leading cause of infertility, but with proper care, you can actually get pregnant. Number 2 is that endometriosis do not have a cure. Take note. It does not have a cure, but it can be managed. Just because it does not have a cure does not mean it cannot be managed. It can be managed. Number 3 is that the treatment options for endometriosis include pain relief, hormonal therapy, and sometimes surgery, just to take out these tissues that are present in other organs that are not supposed to be, right? Now, Another thing to note is that when you diagnose endometriosis early, you can prevent complication, right? You can prevent complication. Now, endometriosis is real. Don't let anybody deceive you or try to tell you that it's not real, is this, is that. It is real, it is happening. But the good news is that it is treatable. An early diagnosis can save you years of pain and complication. Please, women, mothers, ladies, sisters, girls, don't allow anybody to tell you that pain is a proof of womanhood. Pain is not a proof of woman. Don't bear that pain. It could mean that you have endometriosis. It could mean that you have PID. Just get yourself tested, right? Last week we talked about PID. You can go to my YouTube channel and check. You would see what we talked about PID. You can follow me on Facebook and you would see what we talked about on PID, right? Yes. Now, if you are experiencing this serious pain that is allowing you to miss work, miss school, makes you to lie in bed in pain every month, that is your body trying to tell you that something is not right. Now, if this sounds like you or someone you know, please speak up. Share this video to them. See a doctor, ask questions, push for answers. Don't suffer in silence. Pain is not a proof of womanhood. With that, to see you in our next video. Don't forget to subscribe to our YouTube channel, Talk Health with Nurse P. Turn on the notification button so that you'll be the first to get notified when we post a new video.